Hello. Hello, very good evening, everyone. I'm Dr. Sandeep Madaan, your anatomy faculty, and we are going to discuss today in our series that is Medskool at 7 p.m. at DAMS Delhi YouTube channel. And we are going to discuss today. Topic is the trigeminal nerve. All right. So, is everything fine? Can we start today's session? All right. So let me just show you. This is where we have the brainstem, right? So this is above is the midbrain part. What we are looking at right now is the pons, and down here we have the medulla. So these three components are together called as the brainstem. Now in the midbrain, in the pons, this part is the pons. When we look at this way, we have this nucleus. This blue color nucleus is the motor nucleus of the trigeminal. But sensory nuclei are three. One is present in the you see in the pons itself, the main nucleus. One nucleus will be present downward, that is the spinal nucleus. One nucleus will be going above up to the midbrain, that will be mesencephalic nucleus. So these are the nuclei, three sensory and one motor nucleus. Together four nuclei are there. But from there, when you see the distribution, we have the sensory part is there and the motor part is there, correct? So we can say the sensory fibers over here, they are making the trigeminal ganglion, which will be distributed into three parts. Here we can see it will be distributed into these three parts, which we usually talk about: V1, V2, V3. And if you carefully observe, these motor fibers are only joining the V3. That means only mandibular division will be mixed, whereas ophthalmic and maxillary division will be together. You can say they are pure sensory divisions, right? They are pure sensory divisions. Now here, just to show you, these three divisions, they will pass from different foramina, right? They are passing from different foramina. Just to recapitulate what we have learned, let me explain this way. We have from the pons sensory root coming and the motor root coming. I hope now it makes more sense. The sensory root is making the trigeminal ganglion, which is where we have the three divisions V1, V2, V3. And only V3 division over here we can see, which will be joined with the motor branch. It becomes the mixed in nature. Now tell me, dear friends, now our three divisions, they will pass from different fissures of the different foramen. If I ask you, the first division V1 will pass from which foramen? Which foramen of skull, which will be from where this nerve will be passing from? That will be superior orbital fissure. Okay, but it will not pass alone, rather it will divide into three branches, and those branches will be passing through the superior orbital fissure. What are the branches? We will discuss about them a little later, but for timing we can say V1 from the fissure, V2 from the rotundum, and from where the V3 will be passing, that will be your foramen ovale. But now overall, if we talk about the foramen ovale, if we talk about the foramen ovale, we all know that male structures are there which will be passing from the foramen ovale. Can you tell what are the male structures which will be passing from the foramen ovale? Yes, let us revise together. Okay, basically this is a revision of the trigeminal nerve, right? So if you can tell what are the male structures from the foramen ovale: M4, mandibular nerve; A4, accessory meningeal artery; L4, lesser petrosal nerve; and what is E? Emissary vein, right? All right. Just the same thing we can see from here. We have the trigeminal nerve. The trigeminal nerve we have, this is what we have: V1 from the fissure, V2 from the rotundum, and V3 from the foramen ovale. So consecutively they are arranged, है ना? अगर हम ध्यान से देखते हैं skull में, तो we have the three consecutive foramen, और उन three consecutive foramen से we have three consecutive nerves: V1, V2, V3, like that. Making sense? Very good. And if I ask which one is sensory, which one is motor, what will be your answer? V1 and V2 are pure sensory. V3 is mixed in nature because we have seen sensory and motor fibers coming together. I hope this much part is okay. Now that is the beginning that we have seen where from the fibers are coming. What are the types of fiber, whether sensory, motor or mixed, and how the fibers are leaving through the skull. This is the basic stuff that we have talked about. But now what we are going to start is basically the distribution, and let me explain with the help of the branches. Look at this part carefully. This is the distribution. V1 ophthalmic division will be supplying in this area or the territory. V2, if you pay attention, this V2 is present along the floor of the orbit. That is the distribution for the V2. That is maxillary nerve. Please remember this, okay? And V3, the mandibular nerve, as the name says mandibular nerve, it will be traveling within the mandible as inferior alveolar nerve and will be supplying the teeth from below like that. Do you appreciate this? So that is the overall distribution of the 3 division of trigeminal nerve. So far so good? Yeah, very good. For the foramen spinosum also you have told that is the main structures are there, and if you want to revise, can you tell me what are the main structures from the foramen spinosum? Dr. Nidhi, very good. That will be M for which artery? Middle meningeal artery. And E for which artery? E for what? That is emissary vein. And N for nervus spinosum. So far so good? Now dear friends, let us discuss about this part. And also let me tell you that when we say emissaries, we study emissaries in the different foramina. And sometimes students ask me that, sir, why we are reading the emissary here, emissary also written in the other foramina. So dear friends, let me tell you, basically emissary vein is the connector vein which will be connecting the extracranial vein with the intracranial vein. These are the connector veins. And there are various emissary veins which will be passing through various foramina. That's why we study emissary vein in different areas. I hope that clears the doubt. Now we started the discussion from here. We have the sensory root, the motor root coming from the bones, which will be making the trigeminal ganglion. And this will be dividing into V1, V2, V3. Is it making sense, beta? Everyone clear? Motor root will be coming and joining only with this V3 fibers, which will be exiting from the foramen ovale. We will be discussing about the mandibular nerve later. Let us first focus on the fibers of ophthalmic and maxillary division, that is V1 and V2. So far so good. Can we continue from here? Yes. Now dear friends, if we look at the cavernous sinus part, we have the V1 fiber also passing from here, V2 fibers also passing from the cavernous sinus, and beyond that we can say that this fibers, V1 fiber will divide into 3 divisions, and the names of these 3 divisions are lacrimal, frontal, nasociliary, which will be passing from the superior orbital fissure. And after they are exiting from the superior orbital fissure, what will happen? We can say the frontal will divide into supratrochlear and supraorbital. That means it will simply divide into 2 divisions, supratrochlear and supraorbital. Whereas lacrimal nerve simply go to supply the lacrimal gland. And the nasociliary, the important point here is, before coming to the branches, we should know that it holds one ganglion. The ganglion which is being held by the nasociliary nerve is the ciliary ganglion. So ciliary ganglion is being held by the nasociliary nerve, and after that this nasociliary nerve is basically going to supply that these divisions: anterior ethmoidal, posterior ethmoidal, long ciliary, and the infratrochlear. Okay. So I will describe all these branches to you, that what are these branches: anterior ethmoidal, posterior ethmoidal, long ciliary, infratrochlear. I will show you in the diagram. But before going to the diagram, we must have the basic knowledge that what are the branches present over here, right? And also we can say that maxillary nerve will exit from the cavernous sinus. After that, it will come out of the foramen rotundum. Okay. And then it will proceed towards the floor of the orbit. Okay, after that it will go in the floor of the orbit, and the nerve will go here, that is infraorbital nerve. In the floor of the orbit, infraorbital nerve is nothing but the continuation of the maxillary nerve only. All right, now let us move on to the next slide. Here I'll show you all the branches one by one. Okay, basically we will discuss it together. Now dear friends, I have zoomed in. I'll label it also later, but first of all let us revise. Can you tell me what is this ganglion? Yes, quickly I'll be asking this question and you will be answering. Let us revise this part together. What is this ganglion? This is trigeminal ganglion, dividing into V1, V2, V3, ophthalmic, maxillary, mandibular. For the maxillary nerve, this circle, it shows the foramen rotundum. But for the ophthalmic, we can see 3 divisions. Can you see the 3 divisions? Now tell me the name of this nerve. This nerve is simply coming and reaching the lacrimal gland over there. What will be the name of this nerve? Tell me, which is simply coming and supplying the lacrimal gland. This will be what nerve? This will be lacrimal nerve. Very good. This will be lacrimal nerve. And now if you follow this nerve going above and dividing into 2 divisions, supratrochlear and supraorbital, what it should be? This should be frontal nerve. So this is lacrimal nerve reaching the lacrimal gland, frontal nerve which is dividing into supratrochlear and supraorbital. Let me write this much part. So here what we have learned, that this is lacrimal nerve, this is frontal nerve, and here the frontal nerve is dividing into supratrochlear and supraorbital. Supratrochlear and supraorbital. All right. Okay. Are you clear up to this much part? Now tell me the name of this third nerve which is holding the ganglion. The third nerve is nasociliary nerve. But what is the name of the ganglion? The name of the ganglion here is, that is what? The name of the ganglion is, that is ciliary ganglion, right? So here you can say this is the ciliary ganglion, and what are these nerves? This will be anterior ethmoidal nerve. This will be posterior ethmoidal nerve. Okay, anterior ethmoidal nerve, posterior ethmoidal nerve, and one nerve which is going behind the gland. If you can see this one, if above is the supratrochlear, then this will be infratrochlear nerve, right? So let me label here, the ganglion is the ciliary ganglion. The name of the nerve is nasociliary. Okay, this nerve is anterior ethmoidal, this nerve is posterior ethmoidal. Okay, now if you see, if this is supraorbital nerve, this is supratrochlear nerve, this nerve below will be infratrochlear nerve. All right. Now one thing that I would like to show you guys, that if this is the ganglion, with respect to ciliary ganglion, we have these fibers which are short ciliary nerves, but we have these fibers which are long ciliary nerve. Do you appreciate, beta? Short ciliary nerves are postganglionic fibers, whereas long ciliary nerves are the direct fibers coming from the nasociliary. Do you appreciate? So what is the labeling? We can say these fibers are short ciliary, whereas these fibers are long ciliary fibers. So far so good. Could you understand? This nasociliary, short ciliary, long ciliary, all this distribution. Let me zoom in to show you everything up to this much part is okay. Now dear friends, if you have understood this much part, what is very important for us to understand is this orientation, that our maxillary nerve will be exiting from the foramen rotundum. We all know about it. After that, it will be traveling in the floor of the orbit like this. And we all know that in the floor of the orbit, its name will become infraorbital nerve. That means we have the maxillary nerve continuation in the form of infraorbital nerve here. So when it reaches here, it will be supplying the teeth. Look at this part. Below the orbit, we have the palate. In the palate, we have upper jaw teeth. है ना? So these teeth will be called as superior alveolar process. In the lower jaw, we have inferior alveolar process, and accordingly we have the names of the nerves. So superior alveolar processes will be supplied by the superior alveolar nerves. Inferior alveolar processes will be supplied by inferior alveolar nerves. The only difference is we have a single inferior alveolar nerve which will be traveling within the mandible, and it will be supplying the lower jaw teeth from below, right? But for the superior alveolar process, that means upper jaw teeth, we have three set. What are three set? We can see anterior superior alveolar nerve, we can see middle superior alveolar nerve, and we can see posterior superior alveolar nerve. These are the three set of superior alveolar nerve. So we can take the notes. This is anterior superior alveolar nerve, middle superior alveolar nerve, and posterior superior alveolar nerve. Very good. Where we can say that anterior and middle posterior, anterior and middle superior alveolar nerve are the branches of what? They are the branches of infraorbital, whereas posterior are the direct branches of maxillary nerve. Clear now? Anterior and middle, they are the branches from the infraorbital. Posterior is a direct branch. Making sense? Very good. Good to see that you could remember this much part. Now help me with some of the areas. Now if you can tell me, dear friends, what is this bony plate known as? This bony plate is known as what plate? This is called as pterygoid plate. And right now we are discussing about the palate. So this is definitely palate here. So we can say one side we have the pterygoid plate, one side we have the palate. Between the pterygoid plate and the palate we have one gap. That is called as which fossa? That is called as pterygopalatine fossa. Inside we have which ganglion? Inside we have which ganglion? Pterygopalatine ganglion. This is the pterygopalatine ganglion which is being held by the maxillary nerve. This is the pterygopalatine ganglion which is being held by the maxillary nerve. Do you appreciate this part? So here we can write down, this is the pterygopalatine ganglion. Making sense? So far so good. So we have been able to identify all the important nerves which are the distribution of the V1 fibers and the V2 fibers. Is that everything fine up to this much part? Let me add something here, that when you see the pterygopalatine ganglion, we have just now seen the pterygopalatine ganglion. The greater petrosal nerve will be bringing here, lacrimal fibers. But the lacrimal fiber should reach the lacrimal gland. Lacrimal gland is like being supplied by the lacrimal nerve. So our lacrimal fibers have reached here, but their final destination is here. So from here to here, what do they need? They need the connection. They need the communication. How they will be communication? Let me explain. From here, the sensation, the lacrimation will be picked up by the zygomatic nerve, and the zygomatic nerve will eventually divide here into two branches, zygomaticofacial and zygomaticotemporal. But the zygomaticotemporal will give one branch here which will be supplying the lacrimation fibers to the lacrimal gland. So what has happened? Let me explain. Our greater petrosal nerve will be reaching here. In the pterygopalatine ganglion there will be relay. After relay, zygomatic nerve will pick up the postganglionic fiber. Zygomatic nerve will divide into two branches, zygomaticofacial, zygomaticotemporal. But this will be giving one communicating branch over here. So let me show you this particular fibers over here. So greater petrosal nerve has come. in the pterygopalatine ganglion. Zygomatic nerve has come, which has taken this postganglionic fibers, and the zygomatic nerve has divided into zygomaticofacial and zygomaticotemporal, which is giving one communicating branch over here, and this is how the fibers will be reaching the lacrimal gland. I hope that makes sense. Could you understand this much part? Let me show you all these fibers in the diagram. Now understand this part here. Let me just label. This is zygomatic, zygomaticofacial, zygomaticotemporal. Let me zoom in and show you here. Now, dear friends, we can see this is our ganglion. Here the relay will take place, and after that the zygomatic branch will pick up the sensation. Zygomatic itself is dividing into two branches, zygomaticofacial and zygomaticotemporal, but they are giving one communicating branch here. Can you see this branch? This branch is going and it is joining with the lacrimal nerve. Ultimately, they will be using the lacrimal nerve to reach the lacrimal gland. This is the pathway from here, from the pterygopalatine ganglion. The fibers have reached via this and then to the lacrimal gland. Did you understand? This part is making sense to you? Could you appreciate everything over here? All the fibers, nerve fibers, and moreover, have you understood the lacrimation, how it is taking place? So far, so good? Yes, dear friends. If this part is okay, then I would like to add one very important information to you. That is, when we say, like in general, when we say if in a patient lacrimal nerve is not working, what comes to our mind normally? If we do not even think of the if we do not even think of this fibers or anything, simply asking you, if in a patient lacrimal nerve goes, it's like gone, right? What will happen? What will we think? We will simply think that lacrimation is lost. Normally it comes to our mind, yes or no? But that will be not always true, because whenever we are dealing with the nerve injury, the site of nerve injury is very, very important. Okay, let me show you how. The fibers, the pathway that I have just now described to you, let me show you again. Now we are looking at the lacrimal nerve. In this segment, this communicating branch has come. If the fiber is cut here, in the distal half, then these fibers will be also cut. That means with the lacrimal nerve, these fibers will be also cut. And this fiber is the specific fiber for the lacrimation. But if you cut the lacrimal nerve proximal to it, then only lacrimal nerve will be gone. These fibers, communicating branch, will not be cut. In that case, there will be no loss of lacrimation. Why? Because itself lacrimal nerve is a sensory nerve. It is supplying in the lacrimal gland and the surrounding region to pick up the sensation. So if the lacrimal nerve alone is gone, then there will be loss of sensation. But yes, if it is in the distal half, then with the lacrimal nerve, definitely this communicating branch will be also affected. So it will depend whether the proximal half is given in the question or the distal half is given in the question. Did you understand this concept? So it is not that always when you see the lacrimal nerve gone, there is the loss of lacrimation. It's not mandatory. It will depend. Is that all okay? Could you appreciate this point? Yes. So now we can say this greater petrosal nerve is majorly bringing the lacrimal fiber, and this is the pathway for the lacrimation. And not only that, we have learned that how the fibers, if the proximal half is gone, what will happen, and for the lacrimal nerve distal half is gone, then what will happen, correct? Now let us take this question. Question says a 22-year-old patient has dryness of the corneal surface of the eye because of the lack of tears. Which of the following nerves may be damaged? Proximal portion of the lacrimal nerve, zygomatic branch of the facial nerve, lesser petrosal nerve, greater petrosal nerve, what? Yes, definitely. So here the dryness of the corneal surface because of the lack of tears is given. So we are looking at the loss of lacrimation. But we know only in the, why not A is the answer? Because we have just now learned proximal portion will not lead to the loss of lacrimation. Okay. So if we say instead of proximal, if this would have been distal, then it would have led to the loss of lacrimation. Another point, here the branch is given zygomatic branch of facial. Now facial nerve also has zygomatic branch, that will be motor branch. But what we were writing zygomatic here, this is the zygomatic branch of, this is the zygomatic branch of maxillary nerve, V2. It is not zygomatic branch of facial. So zygomatic name may be similar, but that is not basically the one which we are looking for. Okay, instead of zygomatic branch of facial nerve, if they give option zygomatic branch of maxillary nerve is gone, yes, then it will be affected, because it is the zygomatic which has to carry the fibers. Then lesser petrosal not at all involved, greater petrosal, that is the answer over here. Do you appreciate, everyone? So far so good? No. Let it be. All right. Now here I would like to show you this. All right, very good. I like to show you this particular nerve over here, anterior ethmoidal, posterior ethmoidal. Okay, please look at this part. These two nerves, how they, like, what comes to our mind, they look like as if from the orbit they are going above and they are about to reach the anterior cranial fossa. Yes or no? So if you want to see the further course of this anterior ethmoidal and posterior ethmoidal, what can we do? We can remove this bony plate and we can clear the region. After clearing the region, we can see the further course of the nerve. Yes. So let us do that. Let us remove this plate of bone. When we do so, now when we have removed the plate and we have cleared the region, then we can see this is the anterior ethmoidal nerve. This is the posterior ethmoidal nerve. Let me zoom in to show you. These nerves from the orbit, they have gone to the cranial fossa, like in our body, from the orbit to the cranial fossa. Now why are they in the cranial fossa? In the anterior cranial fossa, they are going to supply the meninges, they are supplying the dura. But particularly anterior ethmoidal nerve is not ending over there. Particularly anterior ethmoidal nerve will not end and it will enter the nasal cavity. Then it will enter the nasal cavity. Here we can say that from here this nerve has entered into the nasal cavity. Let me show you what is happening. In the orbit, the nerves were there because our nerve has entered into the orbit. From there, they have entered the cranial fossa. Then from there to the nasal cavity. In the nasal cavity, they will be giving two branches. One is medial, one is lateral. The one which is lateral will be coming on the surface. What will be the name of the branch? And where it will be supplying? It's a question for you guys. Those who have understood and those who know it, please write in the chat box. The nerve on the lateral aspect will come on the surface. What will be the name of the nerve? And what is the distribution of the nerve? And why it is important? The name of the nerve will be external nasal branch. And the territory will be the tip of the nose. Because usually we consider that we have this lower eyelid to the upper lip area. It belongs to the maxillary territory. And above we have the ophthalmic territory, below we have the mandibular territory, correct? But in that sense, we can say this area belongs to the maxillary. But the tip of the nose, we have anterior ethmoidal nerve, which is a branch from ophthalmic division, not from the maxillary division. And that travels within it. It does not come from outside. Do you appreciate this? Okay, so that is how it will be present. So let me write that notes also for you guys. All right. So we can say we have from the orbit into the anterior cranial fossa, into the nasal cavity, we have our nerve coming. The name of the nerve here is anterior ethmoidal nerve, which will be going there in the anterior cranial fossa, then going there in the nasal cavity, then going there medial and lateral. The lateral will come on the surface as external nasal branch, like that. I hope that makes sense. Okay. So dear friends, we have talked in detail about the maxillary divisions. Also, we have talked about in detail about the ophthalmic division. Let me now describe the mandibular nerve. First of all, mandibular nerve is what type of nerve? Sensory, motor, or mixed? In the beginning, when we started the session, we have seen the nuclei. We have seen the fibers. Now tell me, what is the fibers in the mandibular nerve? We all know it is of mixed type. Let me first quickly write down the notes for you, and then I will show you all the branches one by one in the diagram. Okay. So here, to start with, we have sensory and the motor fibers. They come together as a mixed trunk, and then they will be passing from which foramen? From the foramen ovale as mixed trunk. And when they come down as a mixed trunk, it will be holding one ganglion. Can you recall from your anatomical knowledge that this trunk of the mandibular nerve will be holding which ganglion over here? This is nothing but otic ganglion. This is nothing but otic ganglion. Okay. And this is the foramen behind, that is foramen spinosum. That is foramen spinosum. Okay. And what really happens when the mandibular nerve will go out, it itself will go out, but it will send one nerve back. Yes, tell me, dear friends, what is the name of the nerve? This is the recurrent meningeal branch of mandibular nerve. When the mandibular nerve is going out, it is sending the nerve above like that via this foramen. What is the name of the nerve? Name of the nerve is nervus spinosum, because the name of the foramen is foramen spinosum. Name of the nerve will be nervus spinosum. So far so good. Now there is one branch which will be coming out of this otic ganglion, means it passes through otic ganglion. It is not actually related to it. Functionally, it has nothing to do with that. Okay. So dear friends, what is the name of the nerve? Name of the nerve is nerve to medial pterygoid. It is another branch which is given by the trunk. One branch was nervus spinosum, another branch is nerve to medial pterygoid muscle. As the name suggests, it will be supplying the medial pterygoid, but along with the medial pterygoid, it will supply two tensor muscles. Along with medial pterygoid, it will supply two tensor muscle, that is tensor tympani and tensor veli palatini. Okay. After that, it will divide into anterior and posterior division. Now, anterior division, by and large, it supplies, like you can say, muscles of mastication. Like, what are the muscles of mastication? We have four muscles: lateral pterygoid, medial pterygoid, masseter, and the temporalis. Correct? Out of four, one has been already supplied, that is medial pterygoid. So, how many are remaining? Three. So, these three muscles will be getting the supply from the anterior division. What are these three muscles? These three muscles are like lateral pterygoid muscle, then masseter muscle, then temporalis muscle. Okay. But then there is one sensory branch is there, only one sensory branch, that is buccal branch. Buccal branch is a sensory branch. Okay. Important point here is it pierces buccinator, but does not supply it. It only pierces buccinator but does not supply it. Okay. So here, to remember, we use the funny phrase that it says I love you but as a friend. Okay, don't take it otherwise, just to remember this point, that it will only pierce but it won't supply. That's the important part over here. Because why it can't supply? Because it's not a motor branch, it's a sensory branch. So it will be supplying in the region. It will be carrying the sensation from the whole region. Making sense? All right. And what about the posterior division then? From the posterior division, basically we have the branches which are majorly sensory, and to remember the names, we will use a mnemonic. The mnemonic is Ali. Let me write. We have Ali is the mnemonic. A for auriculotemporal nerve, A for auriculotemporal nerve, which is going to supply one gland. Which gland? That is parotid gland. Then L for lingual nerve, which is going to supply anterior 2/3 of tongue. Now, which sensation of anterior 2/3 of tongue will be carried by the lingual nerve? Which sensation from the anterior 2/3 of tongue will be carried by the lingual nerve? General sensation or the taste sensation? And also we need to understand the lingual nerve will be holding one ganglion named as submandibular ganglion. And then we have I for inferior alveolar nerve. This inferior alveolar nerve will be traveling within the bone like this. But before going inside, okay, it will give one branch. The branch is nerve to mylohyoid, which will also supply anterior belly of digastric. Anterior belly of digastric. Okay. And the answer to this question is anterior 2/3 general sensation will be carried by the lingual nerve and the taste sensation will be carried by the coda tympani nerve. Making sense? So this is what we have learned. Auriculotemporal nerve supplying the parotid gland, lingual nerve carrying the general sensation from anterior 2/3, and you see here we can say nerve to mylohyoid also supplying the anterior belly of digastric muscle, and inferior alveolar nerve which will be traveling within the mandible like that. Making sense? Now here we have got this image where we can identify everything, right? So we can see, first of all, let me zoom in to show you that this slender branch, thin branch here is the anterior division. Rest thick one will be the posterior division together. Okay, and we will be identifying the branches, what are anterior branches, what are all posterior branches. But just before that, let me add one point in our schematic diagram, that if I add one artery, can you tell me what is the name of this artery which will be passing between the two roots of auriculotemporal, and then it will be coming out and finally coming out of this foramen spinosum? What is the name of this artery? We have already discussed in the beginning when we discussed about the male structure, about the men structure. That time we talked about this artery. Can you recall? What is the name of this artery which will be passing between the two roots of auriculotemporal, and then it will be passing through the foramen spinosum? That is middle meningeal artery, correct? Now I will take you guys to the image. We will identify everything, but just before that, let us revise this part together. Let us revise this part together. Now, even though screen is there in front of you, I will suggest try and not look at the screen, try to visualize yourself, try to memorize. But yes, wherever it is required, you can take help of the written notes, no problem. So let us start. So to begin with, we have sensory and the motor root coming together. They are making the mixed trunk, which will be passing through which foramen? Foramen ovale. The mixed trunk will go out. It will be sending one nerve back. The nerve going back will be nervus spinosum because it passes through the foramen spinosum. Is that okay? And also the trunk, mixed trunk, will be holding the ganglion. Which ganglion? That is otic ganglion. We know that after that it will be dividing into anterior and posterior division, but before that it will be giving one branch which will be passing through the ganglion, otherwise not at all related to the ganglion. And that nerve is nerve to medial pterygoid. Nerve to medial pterygoid will definitely supply medial pterygoid muscle, but along with that it will also supply two tensor muscle, tensor palatini and tensor tympani. That's it. So we are done with the trunk and its branches directly. Coming to anterior division and posterior division. Anterior division is by and large motor. It supplies the muscles. Which muscles? Mainly the muscles of mastication. So we have the masseter, we have the lateral pterygoid, we have the temporalis muscle. And we have only one sensory branch, that is buccal branch, which will pierce the buccinator, okay, but it will not supply it. Is that okay? But regarding the posterior division, we have the mnemonic here Ali, that is auriculotemporal nerve supplying the parotid gland. L for lingual nerve, which will be supplying the anterior 2/3 of the tongue, which will be carrying which sensation? That is the general sensation from the tongue. And not only that, the lingual nerve will be holding one ganglion named as submandibular ganglion. Then I is for the inferior alveolar nerve. Inferior alveolar nerve will be traveling within the mandible, supplying the teeth from below. And before going inside the mandible, it will give one branch named nerve 2 mylohyoid, which will also supply the anterior belly of digastric. Is that all okay? So far so good. Now all set. Let us go to the diagram and we can identify all the branches then. Let us identify together. Let us identify these branches together. Let me ask you the question. Can you identify this nerve which is having the two roots, and in between the two roots we have one artery present over here? What is the name of the nerve and what is the name of the artery? Tell me this. We know that artery is what we talked about is the middle meningeal artery. It will be passing between the two roots of auriculotemporal, and this auriculotemporal is going to supply, in this region we have the gland, that is the parotid gland. I hope that makes sense, right? So I can simply write it down over here that this artery is middle meningeal artery and this nerve is auriculotemporal nerve. Do you all agree? Yes. All right. Now, as I said, this muscle, this huge muscle coming from outside, it is the temporalis muscle. So these fibers are supplying the temporal muscle. Okay. Now what is this muscle over here? This muscle over here is the lateral pterygoid. And what is this nerve? Is the buccal nerve with the buccinator muscle. Let me show you by zooming in. This is the buccinator with the buccal branch coming in. This muscle is the lateral pterygoid and this muscle is the medial pterygoid. But for the medial pterygoid, branch will be given from the medial aspect. I will show you another diagram from the medial aspect. Right now we can't see that. Okay. So lateral pterygoid is getting the branch from here. And you see here we have cut the bone. If the bone is put in place again, then outside the bone you can see the masseter muscle. So we can see the branch to the masseter going from here only. This is the branch to the masseter going from here. This branch is there, but that will be going outside supplying the masseter muscle. So if I summarize, I can say this is the slender branch supplying the temporalis, lateral pterygoid, masseter as well as buccal branch. Is it all making sense? Behind we can see auriculotemporal nerve, correct? But now let me ask you, and you have to identify this for me. Identify this nerve for me. This nerve is coming and reaching over here, supplying the tongue. Can you see? It is supplying the anterior 2/3 of the tongue. What is this nerve? Can you identify? Yes. What is the name of the nerve? Definitely lingual nerve. And we can see it is holding the ganglion here. What is the name of the ganglion? We have already written in our notes. Let me add. This nerve is definitely lingual nerve. And the name of this ganglion is submandibular ganglion. Correct? Now, dear friends, before proceeding to the other nerves, if I ask you, if this is tongue, can I call this gland as sublingual gland below the tongue? Can I call this gland as sublingual gland? And this gland over here, can I call this gland as submandibular gland? Now, if I say submandibular gland, the name of the ganglion is also submandibular. So the name is submandibular because of the position, but one is ganglion, other will be gland. Do you appreciate this? Could you understand? Let me label this part. I hope that makes sense that this is the submandibular ganglion which is being held, but we have come to the agreement that this is sublingual gland and this is submandibular gland. So far so good? Everyone, could you understand up to this much part? The lingual nerve is coming. This is all happening over here. Everything is making sense to you? Yes? Now, dear friends, let me add the last point over here, that the bone has been cut. When the bone was cut, this nerve was also cut. Otherwise, this nerve was supposed to travel within the bone. What it should be? It should be what? It should be inferior alveolar nerve. It should be inferior alveolar nerve. Is that okay? It should be inferior alveolar nerve. And this inferior alveolar nerve will be traveling within the bone, but before that it will be giving one branch over here, which is coming to this muscle. This muscle is what? The floor of the mouth. If I ask you floor of the mouth, which muscle? That is mylohyoid. Correct? Now dear friends, help me identifying this muscle. We have one muscle where we have one belly, this is anteriorly placed, and one belly which is posteriorly coming from the mastoid. This muscle is coming, posterior belly. It becomes anterior belly. What is this? Digastric. So this particular belly is the anterior belly of digastric. We can say our nerve to mylohyoid will supply the mylohyoid muscle, but also supply the anterior belly of digastric. So we can say this is the mylohyoid and this is the anterior belly of digastric muscle. This is posterior belly of digastric muscle. Everything clear? Could you understand this much part? All the branches we have made, what we have drawn in our schematic diagram, could you identify everything here? One last thing, if you can tell, what is this branch over here which is going to attach, which is going to, you see, connect with the lingual nerve? That is coda tympani. Why it is getting connected? Because coda tympani fibers will relay here in this ganglion of the submandibular. Okay, they will simply relay in the submandibular ganglion like this, and after relay the fibers from them will be going directly to the submandibular gland and some fibers to the sublingual gland. So coda tympani is delivering the fibers here in the submandibular ganglion, where after relay some fiber will go directly to the submandibular gland, some fibers will go via this nerve to the sublingual gland. So basically it is taking care of the salivary fibers which are like you see controlling the submandibular gland secretion as well as the sublingual gland secretion. So in nutshell we can say coda tympani has got two roles. One, it will be delivering the salivary fibers, and second role, it will be carrying the taste sensation from the anterior 2/3 of tongue. So far so good. Let us see the medial aspect of it like this. When you see medial aspect of it, what you can see here, that this is the trunk of the mandibular nerve. Please pay attention. This nerve is the nerve to medial pterygoid. Please pay attention. This is the nerve to medial pterygoid. This muscle is the medial pterygoid muscle. But what is this muscle? This is tensor veli palatini. So it will be supplying one branch to the tensor veli palatini. And what is this muscle? Small muscle to the tympanic membrane. Tensor tympani. So let me tell you, these three muscles are there. This is 1, this is 2, this is 3. Let me zoom in. So this is the medial pterygoid, nerve to medial pterygoid. It will also supply, this is what? Tensor palatini, and this is also going to supply, this is what? Tensor tympani. Do you all understand about this? Because that was the only thing left. Otherwise the division, anterior division, posterior division, all branches we have seen. I hope now everything of the mandibular nerve is also covered. Yes. So dear friends, today we could understand about this ophthalmic division, maxillary division, mandibular division. I hope everything was fine. Where we have seen like from where, which nucleus the fibers are coming, what are the type of fiber, where sensory or motor or mixed, and then we have seen what are the branches, what are the ganglions which are being held, and what is the role of the nerves by and large. I hope everything was fine. Yes, we can take this question now. Tell me, what do you think will be the answer? What do you think will be the answer over here? 17-year-old woman is admitted to the hospital with the signs of cavernous sinus thrombosis, as revealed by radiographic and the physical examination. Yes, danger area of the face. Eventually what is given is the ophthalmic branch of the trigeminal nerve is gone. So basically, which is the most likely will be present here. So now understand this. This type of history, they are talking about the cavernous sinus thrombosis, correct? But then in the cavernous sinus thrombosis, they are specifically saying this has involved only V1 fibers. So we have to see only V1 distribution will be affected. So I told you from the lower eyelid to the upper lip, this area belongs to the sensitive 5 parts belongs to maxillary nerve. So pain in the hard palate, upper lip or the lower eyelid, A, B and D, they are the territory of maxillary nerve. They cannot be involved because that is not involved. According to the given question, only answer that is justifiable, as you have already told, answer will be C. That is, answer will be C, pain from the eyeball. Pain from the eyeball. Making sense? Now, dear friends, here this question, another question I am going to take. What will be your answer in this question? A 16-year-old boy is brought to the emergency department with a blow injury to the left eye during the sports event. The patient has since been having diplopia and diplopia worsens when he looks up. On examination, there is a periorbital ecchymosis is there, in ophthalmos, and limited movement of the left eye. Okay, and visual acuity and the right eye examination are normal. CT scan reveals the orbital floor fracture. Which of the following finding will be seen? Which will be the full finding will be seen here? Answer will be so again, what is happening? The floor of the orbit is gone. Orbital floor. I told you infraorbital nerve. Infraorbital nerve is nothing but the continuity of the maxillary nerve. Again, V2 fibers will be gone, and again we are looking at the C fibers. And what is happening over here is basically orbital floor is fractured. Because of the orbital floor fracture, this inferior rectus is stuck. Okay, inferior rectus is stuck. That's why the patient is not able to look above like that. Okay. Do you appreciate? So this is the floor fracture. There is like entrapment is there. Muscle is not paralyzed, rather entrap. Now this question, which nerve will be passes through the marked foramen here? Very straightforward question. We have the marked foramen and we have been given this mandible. So we know the mandibular, who will be traveling inside the mandible? That is inferior alveolar nerve, which will be traveling within this mandible and will be supplying the teeth from below. So I hope all the concepts are clear with respect to the trigeminal nerve. If you have anything to say, any doubt or any other suggestion, anything, feel free to contact me on any of these media. This is my Instagram, my YouTube channel and Telegram, right? And dear friends, do like our DAMS Delhi and subscribe to this. Thank you so much, everyone. God bless you all. Thank you so much. Take care.